Wendy Thomas. I live in Providence. I'm on the Providence Community Health Center Board. I'm also on Rhode Island Organizing Project, and I'm on the Voices of the Homeless through the Coalition for the Homeless because I was homeless quite a few years ago due to a fire. We take one day at a time. I ended up being in Tanner House for a while, which got me with the right caseworker and got me into where I'm living now. I'm in permanent supportive housing. I'm working to improve myself by getting a voucher and getting another apartment or getting into a elderly apartment because I will be 62 this year. So yeah, we just take one day at a time and do what we can do and try to not get annoyed at the system moving so slowly because there is not enough affordable housing. And there is not enough landlords that will take the vouchers that we have, never mind getting more. So yeah, just moving slowly and trying to do what I can to improve myself and help anybody else that's in the same situation. I can't do it alone. Call your friends, call your governor, call your representatives, encourage them for more affordable housing. Yeah, and hopefully you'll know some landlords, or you are a landlord that will take a section out voucher because that's guaranteed income. We can all just work together and try to get Rhode Island in a better place.
We're just waiting a minute for the screen share feature to be added, but I want to just acknowledge Wendy and that story too. And we're all having a hard time, but imagine the added effort if you were sleeping outside, or if you're even in a housing situation that isn't safe, you're doubled up. Really, it makes everything just so much more challenging when you don't have safe, affordable housing. And so as hard as we may all have it sometimes, struggling with COVID and the Delta variant and schooling from home, it's even more challenging when there isn't that place to call home that's going to keep you warm and a roof over your head. So as Christina introduced, I'm going to do a state of homelessness presentation as I do every year. I want to begin by just thanking everyone for all of their work. These are unprecedented times and the work is harder and harder than it's ever been. And I am in awe of the work and the dedication and the perseverance that I've seen. My remarks today are not going to be fluffy and positive. It's a tough situation we're in. When we talk about the state of homelessness or even the state of where we are in this year, it's not good. I'll end with some good things at the end, but just a fair warning, it's a tough snapshot to give. But I would not be serving you as our audience and our community if I didn't tell you how desperate things are. Last year, as you can see, I compared, as others have, that 2020 was kind of a dumpster fire, really, really tough. And in some ways, I feel like 2021 has been harder because we're tired. We've been persevering and carrying this trauma and this baggage this last year and are still facing new challenges every single day. So I'm going to briefly start with why homelessness happens. I think a lot of you understand this, but for those of you that may not fully get it or don't get how urgent it is now, I think it's always helpful to contextualize it. This is the average cost of a 2-bedroom apartment in Rhode Island, $1,600. This is a lot of money. This is how many hours a week you would need to work on minimum wage just to afford a 1-bedroom. That's not even to afford the 2-bedroom. So imagine you are a single mom with a young baby. You're trying to raise your child, get safe, affordable housing, keep a roof over your head. You don't have the ability to work 65 hours a week. That's almost 2 full-time jobs. So homelessness happens in Rhode Island because there isn't enough housing. There's no city or town in Rhode Island where a medium income renter could afford an apartment. To afford that $1,600 a month 2-bedroom, you would need to make $66,000 a year. And the medium kind of average renter of income of renters is 34,000. Now let's dial in to homelessness, right? So when we think about the Rhode Islanders who are experiencing homelessness, about 43% of them have absolutely no income, and another third make between $6,000 and $12,000 a year. So these are households, families, individuals that are entering our shelter system. And then when we look at the Rhode Islanders who are the most vulnerable, who are staying outdoors, about half of them have absolutely no income. And one little thing here I want to note is you're starting to see the incomes actually increase a little bit year to year, because you can see multiple years here. What's happening is that housing is so expensive that even people with higher incomes, and calling somebody with 18,000 a year a high income, I know is a tone deaf statement, but we're starting to see individuals with more money coming into homelessness because the crisis is that bad. It's impacting more and more individuals. So if you had a Rhode Islander that experienced homelessness that made what we saw in those last charts, let's say $8,000 a year, $200 is what they could afford for rent per month. Show me anything you can rent for $200 per month. You can't even rent a car for that, let alone a room, let alone an apartment. It's simply unsustainable, unreachable. So now I'm going to talk a little bit about where we are in trends. So we've talked about why it's happening. Let's talk about what's happening. And I'll start with COVID-19 and the impact of this pandemic. So there's really three big components of keeping a homeless system and really the rest of our state safe in a pandemic. First is vaccinations, right? If we have a vaccine that is able to prevent the spread of the illness, we should get that out to people, and we are. But there's a fair amount of vaccine hesitancy nationally and within this population. So there's about 45, 50, 55% over time that have been vaccinated that experience homelessness. And that's for a number of reasons. Some of them are too young. Some may be distrustful of state systems. Others have access issues. So you've got a population that is not vaccinated to the extent that could be to prevent the spread. Then you've also got settings where spreading of diseases is really likely. We all talk about daycare colds with our kids. It's a similar setting when you think about how is somebody going to safely isolate in a gymnasium with a bunch of bunk beds. You can't do it. It is a shared setting. So many homeless shelters are just not set up to be disease prevention settings, which makes the last piece and the most important piece is quarantine and isolation. So when you have someone that is COVID positive, that is experiencing homelessness and has no home to safely quarantine in, you need a QI facility. Over the span of the pandemic, the state has had that facility until very recently. We will have it soon again. The state is working on a new location and a new provider. But as of right now, there is no quarantine and isolation option provided by Department of Health for individuals experiencing homelessness that are COVID positive. That is horrifically challenging for the humans that are COVID positive and really for everyone else. And that needs to change, both for their health and the rest of the states. So when we think about the data, just to switch gears out of COVID really quickly, we look at how many people are experiencing homelessness. This is a big indicator for us. And in January, we had about 1,200 people on a given night experiencing homelessness. And that was an increase from last year and a significant increase in the number of those that were living outdoors. Then when we look at homelessness last month, and this is actually not including the domestic violence shelters, which were included in the last slide. So this is an underrepresentation. We had approximately 1,500 people homeless last month. 662 were living outdoors or in cars over a 30-day period. This is a dramatic increase. In previous years, it might be 100, 150 over a 30-day period. I have never in my entire 10, 15 years of doing this, see unsheltered numbers this high. And it's estimated that with the eviction moratorium ending, that it's just going to get worse. So why has unsheltered homelessness increased so dramatically? On this screen here, you can see the 2-week count. So each of these dates, it's whatever was indicated as unsheltered over the last 2 weeks as of that day. You can see how it changes over time. But what is really important to note is that it's increasing. And there are periods where it's a little bit less, and some of that has to do with housing, winter, shelter availability. But really, there just aren't enough emergency resources and people are being forced outside. And so the root of that is a housing market that is completely under-resourced. There is not enough housing for every level of the economy. And we have reached a point of so little housing stock that the system is completely overwhelmed and people have no choice but to head outside because there isn't a shelter bed, there isn't another resource. What there is a park bench, their car. So we're seeing a complete increase in those residing outside. And part of that too, I want everyone to remember too, is that there's also other things that are going on. We have an overdose epidemic happening with a significant increase in the number of overdose deaths. We are all struggling with the physical, mental health toll of this pandemic. High stress can trigger mental health, substance use issues for individuals. And we see with those experiencing homelessness, a significant portion who, particularly unsheltered, who have health conditions, mental health issues, substance use issues that are being exacerbated by their housing status and by the pandemic. Next, I'm going to switch gears to talking about our front door. And the coalition, as of December, is actually operating the Help Center. And this is where you can call. We're actually unveiling a text feature soon, too, to get information about shelter services and whatever else. On average, we get about 4,000 calls a week of Rhode Islanders looking for assistance. And you can see that those numbers have been significantly and scarily high. January of last year, that was 6,000 calls. And this number does change over time, but I think the thing to note is really how significant the number of calls has been. Like, we're really never, it feels like we're moving chairs around on the Titanic. The second you get someone connected with a resource or on the wait list for shelter, there's somebody else that's presenting that needs help, and there just simply isn't enough. And as I've mentioned, we have a large number of people outdoors that are waiting for shelter. And I want to just state, as of last week, we have 53 families with children residing outside. 53 Rhode Island families that are living outside because there isn't shelter space, emergency housing assistance, or even a unit. Let's say they had a voucher, there isn't the unit to physically put them in. They're all living outdoors, and it's getting colder and colder. And really, part of this is a simple supply and demand mismatch. So you can see that the demand, which is the higher number there, and the supply at the bottom, which is referrals to shelter, are mismatched. There is a gap there. And on average, we have a deficit of approximately 31 emergency housing units at each month to meet demand. So there is a backlog, particularly with families. So I'm going to briefly talk on who experiences homelessness, just to give everybody a reminder. I spoke earlier about income, so you have a sense that it's certainly individuals that have a very low income, and that is the key reason people are homeless. They can simply not afford rent. But we see a variety of situations in really every other way. We see a variety of ages. So again, 152 children are living in emergency shelter. We also see less and less individuals at high ages. And one might wonder why that is. And it's because experiencing homelessness is so traumatic and bad for your health that you die 20 years sooner than the average population. So 49.5 years of age is the average life expectancy of somebody experiencing homelessness. So it is a public health crisis. We also see a disparity in race and ethnicity. So this is a chart that shows families by race. So although Black Rhode Islanders make up only 6% of the state, they represent about half of the families living outside or in their cars. That is insidious, that is horrific, that is a sign of the systemic racism in our community for years and years and years, and a sign that we aren't doing enough. We also see that same disparity when we look at single adults and couples. And then when we take and focus in on Hispanic or Latinx Rhode Islanders, we also see a similar disparity. 15% of the population, 41% of those living in shelter when we're looking at families, and a similar disparity for single adults and couples. So I've talked to you about all of the horrific things, the racial disparities, the lack of units, the overwhelming homelessness that we're seeing. I do want to briefly, before I go into how we can fix it, talk about some good things that have happened, because I don't want it to be a completely devastating event. And there are wonderful work that is happening. So we have three big categories that I want to highlight. We've gotten some major federal grants. So there's finally going to be some money coming in to address youth homelessness in the state, as well as some emergency housing vouchers that came down from HUD. So these are resources in the desert we're in that allow us to house youth experiencing homelessness, house families, and get people out of the cycle of homelessness. We've also had some huge policy wins, the housing bond, permanent funding housing in the budget, source of income discrimination banned, pay for success passed, and both the policy wins and our federal grants could not have happened without our government partners. So our Senator Reid and our entire federal delegation advocating for the grants that are going to address these issues. And then I am so grateful to the General Assembly for everything they did this last session. I have never seen a General Assembly so supportive of this work, and I am beyond grateful for their recognition of this issue and their support of it. And lastly, we've also made some system changes that we're excited about. This help center is now open 365 days a year. You can call or text and get a live agent till 9 p.m. every day, including the holidays. We've also made some improvements to our database to make that easier and data more accessible. So while it is largely a very challenging picture when we consider the state of homelessness, it is certainly having some positive impacts that we're happy to share. So what's next? What do we need to do? Well, we need the state of Rhode Island to invest $500 million of the American Rescue Plan Act in affordable housing. We need to treat homelessness as the emergency that it is and immediately act to address this challenge. We need housing resources now. This is not something that can wait for the budget, that can wait for General Assembly to gavel back into session. We need to be addressing this crisis immediately. And part of that is supporting and funding emergency programs. So the housing obviously is a long-term solution, but if people are dying on the streets, that housing that's going to come down a couple of years from now isn't going to help us then. So innovative programs like Echo Village by House of Hope, hotel programs, the fabulous diversion program at Crossroads, Rhode Island, safe parking lots. These are all crisis response programs that work, we know work, that need to be funded and need to be funded urgently. We also need the federal government and our fabulous delegation to continue to do what it's doing, advocating for housing choice vouchers to be expanded and converted into a title program so everybody who is eligible gets it. We need HUD to continue to invest essential funding for homeless assistance grants, and whatever regulatory waivers need to be continued and expanded so that we can continue to be effective and nimble in these challenging times. So I just want to say thank you for listening to this address, and I look forward to working with you on all of these initiatives and having more successes to share with you next year.